With the great name of Allah, who is the most merciful and gracious. Today we will talk about influenza and dengue, which is a microbiology presentation for the one who want to prepare presentation on microbiology and influenza and dengue. In this topic we will first talk about dengue virus. So dengue is an acute viral disease with the incubation period of 5 to 6 days. Acute viral disease means that its symptom occurs suddenly and it has short period of time. And incubation periods mean that the appearance of the viruses occur within 5 to 6 days. Dengue is caused by dengue virus. There are 4 types of dengue virus: dengue 1, 2, 3 and 4. And these viruses are serological related. It means that they have same antigenic structure, due to which they are more severe cases when there is secondary response. These viruses belong to the Flaviviridae family. Flaviviridae has 5 categories, and these categories, one is flavivirus, and this flavivirus is a type of arbovirus. And arbovirus are those viruses which are transmitted to arthropods. Arthropod virus, which is transmitted to Aedes aegypti, and Aedes aegypti is a mosquito, as you see in a diagram. And in dengue virus mainly occur there is dengue fever, which has been known for more than 200 years ago. Dengue virus is mainly responsible for dengue fever. Secondly, we study about the structure of dengue virus. So dengue virus is an envelope virus which is surrounded by a membrane called envelope. Inner to envelope matrix is present, and capsid is icosahedral. It means that its capsid has 20 sides. Genetic materials are present inside the capsid. Genetic material contain phagosynthetic single-stranded linear RNA, and dengue virus contain 10 types of protein. In these 10 types of protein, 3 types of protein are structural protein, that is C protein which form capsid, and M protein which form matrix, and E protein which form envelope. And the other 7 types of protein are non-structural protein, that is NS1, NS2A, NS2B, NS3, NS4A, NS5B, and NS5B. And this is the structure of the dengue virus. There is one is immature and other is mature. When virus have E envelope E proteins, then it is called mature virus protein, and when M protein is surrounded by C protein, then it is called mature virus proteins. Let's talk about replication of dengue virus. When infected mosquito bite a healthy person partaking protein which is required for mosquito to lay egg, it leaves dengue virus in human blood. The dengue virus has ability to bind to any receptor in the human body. The E protein of dengue virus bind to the cellular receptor of antigen presenting cells. The virus penetrates the cell through endocytosis and remain inside endosome. To survive and replicate, the 2 conditions are required for virus. The first condition is that the environment inside the endosome becomes acidic. The second condition is that the endosome is negatively charged. After this condition, the virus envelope binds to the endosomal membrane and release genetic material inside the cell. The faltosins RNA is converted into negatosins RNA, which act as a template strand, make various strands proteins. These various strand proteins moves to the rough endoplasmic reticulum. In rough endoplasmic reticulum, capsid is formed around genome called nucleocapsid. Then nucleocapsid is surrounded by envelope. Then they move to the Golgi apparatus where glycosylation occurs. Now they release from the cell through budding. As you see that the first step is fusion, the other step is disassembly, and the third step is replication, and replication occurs outside the host cell nucleus, and the other is assembly where occur in rough endoplasmic reticulum, and the sixth step is maturation, and the seventh step is releasing, which is a budding. And the symptoms of dengue virus are fever, headache, arthralgia, which is a joint pain, myalgia, which is a brick bone disease, या muscle pains, rash, nausea, and vomiting. How virus can be diagnosed? It can be based on the physical symptoms and it may be a clinical test. There are two types of tests. The first test is antigen test, which is in which NS1 antigen is detected after 1 to 2 days of fever. And the second test is the antibody test, in which immunoglobulin M and immunoglobulin G is detected after 5 to 10 days of fever. In the second test, if both immunoglobulin M and IgG are positive, then infection is recently. If IgM is negative and IgG is positive, then past infection occur. And the other test is also occur, which is RT-PCR, in which viral DNA are detected. Dengue rapid test and platelet tests, because in dengue virus there is lower concentration of platelets, which is called thrombocytopenia. That is why this test is performed to detect the dengue virus. Treatment: it is largely asymptomatic and may be symptomatic and supportive. Treatment will be occur upon symptom. There is no accurate treatment for dengue virus and there is no vaccine available. Only acetaminophen is recommended for the management of the fever. Preventive measure: avoiding exposure to mosquito, use of mosquito repellent. No such respective vaccine available yet. And other is destroy mosquito breeding places, sleep under mosquito net, wear protective clothing, insect repellent, take some fever medication, rest as much as possible, drink plenty of water and doctor consultation. Now let's talk about influenza virus. Influenza is typically referred to as flu, contagious viral respiratory illness caused by influenza virus. They infect nose, throat, and sometimes lung. They belong to Orthomyxoviridae family of virus. They withstand slow drying at room temperature. They can survive in cold sea water for several weeks. Can be preserved for a long period at -70 degrees C temperature. Remain viable indefinitely when freeze dried. They are single-stranded negative-sense RNA, cause acute respiratory tract infection. Incubation period is 24 to 72 hours. Source is nasopharyngeal secretion. The shape of influenza virus is spherical in shape but may be filamentous as shown in the figure. Size: it weighs with a diameter of 80 to 120 nanometer. It is also enveloped virus, which is lipoprotein in nature. Envelope contains two different varieties of glycoproteins. One is hemagglutinin, which perform attachment, and neuraminidase, which perform release. And hemagglutinin is triangular in shape and neuraminidase is umbrella shape. Inside envelope, matrix protein is present which support envelope. Inside matrix, genome is surrounded by capsid. Influenza genome is consists of 8 strands of RNA. This is the structure of influenza virus. There are three types of influenza virus: influenza A, B, and C. Influenza A virus has respiratory and constitutional symptoms. Constitutional symptoms mean that there is another symptom also occur, that is pneumonia. Genetics rRNA segment and it contains 10 viral protein. This virus causes epidemic disease and also greatly pandemic disease. Highest genetic drift as well as genetic shape. Influenza A is the major cause of recurrent pandemics. Their hosts are human, birds, pigs, horses, dogs. Vaccine is available for influenza A virus. Influenza B virus. Type B strain are also associated with epidemics. This virus has similar symptoms as influenza A virus. Contain 8 RNA segments and contain 11 viral proteins. Genetic drift occur but genetic shift does not occur. No pandemic. Their host is only human. Vaccine is available for influenza B virus. Influenza C virus occur throughout the year unlike the seasonal pattern observed in influenza A and B virus. Type C strain are endemic throughout the year, not epidemic. Cause mild disease common in children. No pandemic. Genetic contains 7 gene segments and 9 viral proteins. Low genetic drift and no genetic shaft. Their host is human, dogs, pigs. Vaccine is not available. Epidemiology. Influenza virus is divided into three types based on their antigenic structure. Influenza virus is remarkable because of the frequent antigenic changes that occur in hemagglutinin and neuraminidase. Influenza has ability to undergo antigenic variation which may be antigenic drift or antigenic shaped. These are responsible for unique epidemiological features of influenza. What is antigenic drift? Antigenic drift is due to point mutation and selection leading to the minor changes in hemagglutinin or neuraminidase or both. Cause local outbreak of influenza every 1 to 3 years. Type A strain exhibit antigenic shape and cause epidemic to the previous strain. And this is the structure which show antigenic drift and antigenic shape. In antigenic drift there is minor changes, while in antigenic shape there are rapid changes. How replication occurs in influenza virus. When virus enter the body through respiratory tract, they bind to the epithelial cell of respiratory tract. Hemagglutinin bind with the sialic acid. Then they penetrate cell through receptor-mediated endocytosis. Endosome span around membrane for protection. Hydrogen ion come to the endosome through M2 proteins. This causes release of viral genome in the nucleus of the cell. The negative sense RNA is converted into positive sense RNA through RNA-dependent RNA polymerase. The positive sense RNA act as a template and make various strains. The new rion is assembled in rough endoplasmic reticulum where capsule and envelope is formed. Then they move to the Golgi apparatus where glycosylation occurs. Now they release from cell through budding. Hemagglutinin now again bind to the sialic acid which prevent the virus to prep. Neuraminidase contain N-acetyl-neuraminic acid which prevent binding of hemagglutinin to sialic acid. As you see in the diagram, the first step is a bending in which influenza virus penetrate the cell. The second step is the entry in which endosome is lysed and viral genome is released. The third step is replication in which viral or messenger RNA replicate and make various protein. And the fourth step is transcription where maturation occurs in Golgi apparatus, and the assembly in which a Golgi apparatus there is occur maturation. And the sixth step is budding, and the seventh step is the release. Sign and symptom. The incubation period of influenza virus is 1 to 3 days, characterized by sudden onset of fever, malaise, chill, muscular cramps, and cough after incubation period. In most cases, what we see is uncomplicated influenza. The symptoms of influenza A and B are very similar. The complications of influenza are otitis media, sinusitis, bronchitis, and pneumonia. Pneumonia occurs due to secondary bacterial infection. Rare complications are Reyes syndrome, cardiac and nervous manifestation. Infection with type C cause only a common cold-like illness. What is Reyes syndrome? It is a rare serious condition that causes swelling in the liver and brain. In most cases, it affects children and teenagers recovering from a viral infection, commonly the flu or chickenpox. There is a symptom neurological, respiratory, gastrointestinal, mucoskeletal, neurological, cardiac, and respiratory progeny and mucoskeletal symptoms of influenza virus. There is some difference between the symptoms of the cold and influenza. In cold, fever occur rare, while influenza fever occur 100 degrees C or higher. Headache is rare in cold, while it is usual can be severe in influenza. Chill is uncommon in cold, while influenza virus is common, and these are the some of the symptom between difference of the symptom between the cold and influenza. How influenza virus is diagnosed. Clinically diagnosed physical assessment influenza outbreak in community. RT-PCR can detect viral RNA more accurate and great sensitivity and specificity. Rapid influenza diagnostic detect viral antigen and give faster result but have low sensitivity and specificity. And it is based on hemagglutinin reaction, in which hemagglutinin bend with the RBCs and form a complex structure. How influenza virus is transmitted. The disease is transmitted by direct contact with respiratory secretion. Endospit can occur by fomites and other articles contaminated with respiratory secretion. Influenza is airborne disease transmitted by airborne respiratory droplets as you see in the diagram. Treatment. There is no cover up influenza. We provide supportive care to the patient. Rest, hydration, medication like antiviral, analgesic, which is a painkiller, cough suppressant is used to treat influenza virus. And prevention, avoid close contact, stay home when you are sick, cover your mouth and nose, clean